Good afternoon. Great
Thank
to
you. Good
have you.
afternoon.
Good afternoon. Great to have you.
Hello. Good
What's the?
afternoon.
Yes, I can hear you. I can hear you now. The network was a bit shaky there, but I can hear you now. So, what's the state's preparedness level for this second phase of the coordination?
Okay. In Cross River State, by next week, we will actually commence the second dose of vaccination of those who have actually had the first dose. And for us in the state, we're already putting in place all the mechanisms that is required. Health workers are already undergoing some form of a refresher training as well. So at least to see how they can, carry out registration seamlessly without any challenges, as well as other information that they will require. Also, in terms of preparing our cold stores in the various LGAs so that they can also receive the vaccines, all that is already being put in place. A lot of sensitization and awareness creation has also started just to ensure that those who have had the first dosage will make themselves available and visit any nearby government facility to have the second dose of the vaccine.
All right, but how would you rate the first phase, the success rate? How would you rate it at this point?
Okay, so for Cross River State, I know we did exceptionally well because we actually achieved the 100% coverage based on the number of vaccines that we were given. Initially, we received about 53,840 doses of COVID-19 vaccine, the AstraZeneca vaccine, and we were able to vaccinate more than 60% of people who were supposed to get, because we were expected to use about 50% of that. And because of how Cross River did, since there was high demand for vaccine in Cross River State, NPSC even sent additional 25,000 doses to Cross River State. Currently, we are trying to utilize the 25,000 doses that have been sent, still in the first phase, while we will commence second dosage just for those who have already had the last month by next week. So I'm very pleased with the response so far. There's been high demand for the vaccines in Cross River State, and I'm very certain that subsequent phases, people are still going to respond the way we hope that they should.
But have you had to deal with vaccine hesitancy in the state?
Okay, yes. So in Cross River State, we actually experienced vaccine hesitancy. The same challenges that were faced in other states. Here, of course, based on the false or the rumors that have been spreading, we had to, do a lot of sensitization, a lot of reorientation, a lot of engagement, and at the end of the day, when they actually, they were able to, surmount. So we were not spared at all in that aspect, but I'm glad that with the team we have on ground, where a lot of sensitization took place, and we've had support so far working with traditional rulers, religious leaders, as well as strategic leaders in the state. And for the fact that they were vaccinated, people actually were confident enough to take the vaccine, saying that key people have also had the vaccine, and as well, we've not had any serious adverse events following immunization. So, so far, I'm pleased that at least there's been that wonderful response, despite the initial challenge we had with people, being hesitant to take the vaccine. But so far, I'm glad that we were doing very well.
All right, Dr. Ekweyon, would you say the vaccination campaign has been effective so far in slowing the infection rate?
Okay, yes, I would say so, because if you look at the numbers of cases that are being recorded every day, you will agree with me that the numbers have gone down drastically, and that's not far-fetched. The fact that more and more people are becoming vaccinated, and the fact that more and more people are becoming very conscious and, of course, trying their best to live responsibly and protecting themselves, carrying out all the preventive measures. That has also played a key role. But definitely the fact that more and more Nigerians, because so 2 million people have been vaccinated in Nigeria. That's a lot, hoping to achieve the 70% Nigerians should be vaccinated. I'm certain that at least we would have achieved herd immunity then. And then I'm very sure that we would have been able to also reduce the level.
Okay. All right, Dr. Ekpayoga, I guess we'll have to leave it there. Thank you so much for your time on the program. Dr. Janet Ekpayoga is Director General, Cross River State Primary Healthcare Development Agency.